Welcome to Autism Tips and Tools, where we highlight the best practical guidance from previous episodes of Autism Knows No Borders. Whether you're a self-advocate, a family member, or a service provider, there's something here for you. I'm Rachel Harmon, a professional in the field of autism services, outreach, and advocacy, and the following clip is from my conversation with Dr. Megan DeLeon. Megan is a Board Certified Behavior Analyst and the founder of the Do Better movement, a professional development initiative for behavior analysts aimed at developing humane, culturally informed, and compassionate interventions. Here's Megan talking about how behavior analysts can do better in the areas of early intervention and addressing challenging behaviors.
So one is early intervention. That's where I was initially trained, and I think that's where a lot of people start in this field. It's so appealing to hang out with little 2 and 3-year-olds all day long. So I think from a developmental perspective, a lot of us, myself included at the time, when I first started in the field, aren't trained well enough on typical development and what to really expect from 18-month-olds up to really any age, any of the ages we're working with. But especially for that young of a population, there's seems to be some really wild and unrealistic expectations for what a young child should be doing, like sitting at a table for an hour or really not tantruming at all. Like I had clients where we had behavior plans to try to have 0 tantrums. And if you've ever met a 2-year-old, it's
Right.
not realistic.
Yeah.
But also what's focused on during those sessions. When I first started in the field and still for a lot of early intervention, the focus is on trying to normalize and get, academics, shapes, colors, numbers, letters, like all these skills that you would see being taught in like preschool or kindergarten. And the justification I was told when I started in the field was to get those skills mastered so when they start school, they can be more ready to like maybe learn social skills and interact with their peers. But when you look at the research on autism, all of the research shows the learners who make the most progress and have the best outcomes are ones who demonstrate certain play and spontaneous behavior at a very young age. So if we go in there and we're only working on typical like preschool and kindergarten skills and trying to sit at a table and we're not working on relationship building or play skills, we're really doing a disservice. That doesn't mean, obviously lots of children have, done well with that style of therapy, but at the cost of what else, and then what problems kind of creep up later that we don't even know of because we only have them when they're little. So then they go off to school and we think we did a great job, but who knows what's happening while they're actually in school, right? So that's one area I think we need to learn more about typical development and focus on that relationship piece and really looking at the social aspect of that's what the diagnosis is, and not in a way that forces someone to mask or pretend like be a neurotypical, but in a way that helps with self-advocacy and really learning how to navigate things. And if somebody's motivated and wants to be more social, giving them the skill sets to do that. But if they'd prefer to be more of an introvert and like pull back, giving them the skill sets to advocate and like navigate those situations too.
Yeah, that's a good point.
So that's one. The second one is just how we address challenging behavior. That's the one that I've spent probably the most time on. If you look at the 2018 webinars, I think probably half of them talk about challenging behavior.
Yeah, I've seen some of those and gotten some of my CEUs from you.
Yeah, so that's been a passion area of mine since at least 2010. But we're trained to look at function and look at why challenging behavior might be happening, which is there's nothing wrong with that. But unfortunately, it seems like that's all people are attending to nowadays. Like as long as they can figure out what's happening that could be making the behavior persist. So the child might get out of doing a task, or they might get attention, or they might be given their favorite toy. If those clear patterns exist, a lot of people think if you just remove that thing, you don't let them out of the task, you don't give them attention, you don't give them the toy, that would be enough to shift and see a decrease in the challenging behavior because it's no longer effective for them. And that does simplistically work in quite a few situations, but there's also a lot of situations where that's one piece of what's happening and there's a lot more going on. There's skill deficits, there's things happening in the environment to trigger the challenging behavior, there's emotion, like being able to navigate emotions and really figure out how to properly respond when things aren't going the way they want them to. And all of that kind of stuff doesn't get assessed and doesn't get taught or targeted. It just seems like people think it will magically happen. If we don't provide the reinforcer, if we don't give them the why of why they're engaging in their challenging behavior, it'll just stop. And like I said, I've had clients, of course, where that is the case. It was that simple. But if I assessed them, all of those other things would have been taken care of. They didn't have skill deficits, they could communicate just fine. It was just this environment that was set up to reinforce the challenging behavior. Unfortunately, for a lot of the cases that most of us have, especially nowadays with more and more people accessing services, they're not as simple as that.
Right. It's so important to teach something functional that the learner can do so that they can gain that access to whatever the reinforcer is, whatever is causing that challenging behavior, because it's usually just a deficit in communication.
Yeah.
Like being able to tell someone that they don't want whatever it is or that they want it. Yeah.
Right. I think one of the biggest things that jumps out at me, especially for the younger learners, and I think it's because I have a 4.5-year-old, it's not sometimes just even the communication. It is more about like their body is feeling a certain way and like acting on that. So it just blows my mind. My 4.5-year-old, typical communication, interacts with me just fine. But the moment something stressful is happening in the environment, it's like he doesn't have any skills whatsoever. And we're all like that. When we're in stressful situations, our skill sets decrease greatly. And there's research that's been done on it. Yet somehow we try to expect the learners we're working with to exhibit skills that are already difficult for them in difficult environments when it's stressful. So some of it's also just figuring out how to teach them not just to communicate what is wrong or what needs to be changed or what they need or want, but how do your body's feeling this certain way and like what do you do with that? Do you kick a wall or do you take a deep breath and like try to recenter yourself?
Right. Those coping strategies. Yeah. And I think a lot of what is overlooked too when we're trying to help people with autism is their sensory needs. Like I'm realizing this now after talking to a lot of adults with autism who are reflecting on therapies that they've received growing up and how, at some points, like it's torturous to force someone to look at someone else in the eye or to force someone to stop flapping their hands. I know people don't really implement programs like this anymore, I hope, but it wasn't so long ago that people were.
Right. And unfortunately, I think some people still do, but it is definitely a lot less than it used to be. And that's something I think about. I'm not certified in trauma-informed care, but I have listened to a lot of the different podcasts or presentations on that topic. And what's interesting to me is they talk about ACE, which is a trauma scale, and it looks at different things that a child might have experienced and kind of sort of predicts what might be difficult.
Are you talking about the ACE, like adverse childhood experiences?
Yep.
Okay.
Yep.
Yeah. That's the one that predicts what medical challenges they might have as an adult.
Yes. So I've listened to a few different presentations on that, and I was fortunate back in, I think it was 2014, there's a really great conference in Cleveland called Milestones Autism Conference, and the keynote speaker, I'm pretty sure it was Stephen Shore, and he's a very popular self-advocate, and he did this exercise with us where we were in a group of 2 or 3 people, and one person was just making lots of noises, and another person was doing a lot of like movement in your face, and then you had to try to like solve a problem of some sort while like all of that was happening around you. And he was like, this is my life. This is what I experience every minute of every day. And like now you have like a glimpse of what it feels like. And I think about that, and I think about some of the other stories I see shared by people with an autism diagnosis. And it makes me wonder, if we can measure these adverse childhood experiences that people have, how does the different sensory experiences that having autism gives, not everyone, but, there's obviously some aspect of the diagnosis that results in that. Like, so how traumatic is just like their day-to-day, minute-to-minute experience? And then we're potentially adding to that trauma in the way that we're trying to navigate the challenging behavior instead of being supportive and really looking at, taking their perspective and figuring out what can we do to help you learn to cope with this and then build skill sets around it.
Mm-hmm. Yes, yes. And like dealing with tantrum behavior, if we are told strictly to follow through, and maybe continue placing whatever instruction we were placing or continue withholding whatever we were withholding for like an hour or something.
Yep.
Because that's just, the strict way to do ABA. What kind of harm are we causing to that child who now will have burned in their memory like this hour tantrum with an adult that they were supposed to trust?
Right. Yep. And that's where I go back to that passion moment that we were talking about, because that was that little 18-month-old. And it wasn't just an hour. It was like a whole weekend and then a few weeks of just tantrums with us every time he would see us. Right. And it's like the fact that we were able to regain a relationship with him and figure out how to connect with him and be more playful after he had experienced all of that other trauma with us was just amazing to me. I guess it shows some level of resilience for that age, but at the same time, it's like, is that what you want your default to be, that you start there and then like repair a relationship? Or do you want it to be strong to begin with and you never have to go there?
Thanks for tuning in to Autism Knows No Borders. Would you like to hear Megan talk about how to improve collaboration with parents or other professionals and provide services with compassion? Follow the link in the show notes for the full conversation. And be sure to subscribe for more insights from people connected to autism, inspiring change, and building community. Let's work together to transform how the world relates to autism. Thanks for listening. Take care.